Hello, everyone, and thank you for joining us this morning. My name is Jasmine, and I am the Y.E.S coordinator here at the North Suburban YMCA. It is my pleasure to welcome you to Heal Hip Pain Naturally by Denise Schwartz, licensed physical therapist and owner of the Manual Touch Physical Therapy in Wheeling. Today, she'll be walking us through a workshop that will help identify causes of hip pain and how to ease hip pain. We will be recording today's session to make it available as a podcast on our Y.E.S website. So, if you are a Y member, you will be able to reference it down the road as well. The YMCA Education Series programs typically last an hour. Denise will take questions both during and at the end of her presentation. If everyone could mute themselves during the presentation so that background noise doesn't interfere, you can then unmute yourself when they open the forum for questions. The YMCA Education Series is free and open to the public, but as a nonprofit organization, we are always happy to receive donations from you. If you enjoyed today's program and would like to support adult programming at the North Suburban YMCA, please feel free to make a donation to our Y by going to our website. Again, thank you for joining us today, and a special thank you to Denise. Now I will let Denise talk to you about hip pain. Let's welcome Denise.
Okay. Looks like a couple people need to mute themselves.
Yeah, how do you do that?
Look
Oh, I
down.
can go ahead and do it. Yeah. I've got
Okay.
control.
Okay. All right. And I'm going to share my screen. Um, okay. All right. You guys, you can see my mouse moving around here. Okay.
Yes.
Yeah, just a little bit of housekeeping. I can't see you and I can't see myself. So we're just going to be looking at the PowerPoint. Thank you, Jasmine, for having me. Jasmine said it would be best if you put any questions you might have because I can't see you. It'll be better to do all questions at the end. So put them either in the chat box, write them down so you remember, and I'll be happy to answer anything at the end. Okay, all right. So thank you, Jasmine, for having me. My name is Denise Schwartz. I am a physical therapist and owner of the Manual Touch Physical Therapy in Wheeling. We use traditional and non-traditional therapies to get people back doing the things they love to do. And I've been a PT for a really long time. So it is 2021, and my son Drew had graduated college 2 years earlier, so that would make him maybe 24. And he called me up and he said, Mom, I want to get back to triathlon racing, but I need to get over my injuries. So I was thrilled that he called me to ask him to help. He started doing triathlons when he was 14 years old, and he soon was winning his age group in every race he entered. He went on to compete at a junior elite level and collegiate level, becoming nationally ranked at the collegiate level. But once he graduated college, he took a couple years off to nurse some injuries and become an adult. You know, it takes a while to get used to that. So he decided to make his return at the Pleasant Prairie Triathlon in Kenosha, Wisconsin, where he would swim a half a mile in a small lake, bike 12 miles, and run a 5K, 3.1 miles. Uh, and so first what I did with him is I videotaped him running on, well, here's the beginning of a race. So that's a junior elite race. They all just kind of swim on top of each other. Um, the first thing I did with him was I videotaped him running on a treadmill to assess his form. I provided him with some form recommendations, some exercises, some hands-on work to get him over his injury. But what I really did was provided him with a lot of encouragement and reassurance. There was many a night I'd get a phone call, Mom, my hip hurts. What can I do? My mom, my calf hurts now. I don't think I can run. And I'd have to talk him off the ledge and get him saying, you know, you're doing okay. We'll tweak his plan or tell him he's fine. He can keep running. That's biking, running. So now the Pleasant Prairie Triathlon was unique in that it attracted a lot of para athletes. These are athletes with disabilities. I saw athletes biking without the prosthetic, so disabilities such as amputation, paralysis, blindness. Here's somebody biking without a prosthesis. Here's someone biking with a prosthesis. Um, Here is a person who's probably blind and needed a set of eyes, so they were on a tandem bike. So what's interesting about as I was watching all these athletes, the para athletes, other than their disability, they looked just like the other athletes. They were all confident in what they were doing. They all competed. They all felt competitive. And I know from working with people who have an injury, pain, disability, it's not always like that. They start out the same, like my son. They're like, oh, I have an ache or a niggle or a pain, and I don't know what to do. And we're always providing reassurance and encouragement. And I know that these para athletes in the beginning, they probably just, in the beginning, whether they were just injured or born with the disability, had to learn how to function, how to get onto the toilet, how to change clothes. And as they went along in the rehab process, they got to a place of acceptance of their disability or their limitations, but they didn't let it define them. Then they could create new goals because you never quite know what you can do until you look at things in a new way. So now you may not have a goal of running a triathlon or competing in a triathlon, but maybe you just want to walk without hip pain, or you want to golf or pickleball or some other activity without pain. Or maybe you'd just be able to cook or stand or hang out with your friends without pain. So those are some of the goals that we always want to work towards. So today, we're going to talk about the 3 common diagnoses of hip pain that I see. We'll go through some anatomy and what you can do about it. All right. So when someone comes to see me in physical therapy, we ask them, why are you here? What's the issue? And the common complaints of someone with hip pain is they'll tell me it hurts after when I sit for too long. And I sit to then stand up after a while, then it hurts. It could be when they're just standing, it hurts. It could be with walking. It could be after walking 20 minutes, laying on their side. Someone might say it's hard to put on their shoes and socks, or bending down or squatting. They can't do the things that they want to do. They can't roll over in bed. They may actually have some incontinence. Uh, uh, Sex may be uncomfortable. They may feel weak driving. So there's a lot of different complaints that go along with hip pain, and we use that information to discern where it's really coming from. And the next thing we want to know, is it in the front of your hip, the side, your back, the groin? That also gives us clues as to what is going on and what's really the problem. All right, so these are the 3 common diagnoses, and I'm going to talk about them as I go through the anatomy. Arthritis, degeneration, weakness is actually a diagnosis, or a tendonitis or bursitis, which usually, people usually have weakness with all the other stuff too, but sometimes it's just weak. Excuse me, for various reasons. All right. So here is you on the inside, all your bones. Here is your hip joint. It's a ball and socket joint. So this is your long thigh bone, your femur, and on the end, it's a ball, and it sits in the socket of your pelvis. Your pelvis has 3 different names. This particular area where the ball sits in is called your acetabulum. And the hip, kind of like the shoulder joint, can move in all different directions, okay? And because of that, it can be unstable. It can be an unstable joint. And when it's painful, and if it's a real joint problem, such as arthritis, sometimes there isn't much you can do except replace it. And we'll talk about that in a minute. But what I want you to see here, and I want you to remember, is the old kid song. Your foot bone is connected to your shin bone, connected to your hip bone. So just because you have hip pain, and that may be where the diagnosis is, but it may be because something else was going on. It could be that you have poor foot mechanics. It could be because you have stenosis in your back. You don't move well up here. So it's very important. Everything is connected. So we're always looking at the whole body. Okay. And I think watching the dancing skeleton really, lets you know you start bouncing off your toes, your hip is doing something. So it could be a foot problem that's causing this hip problem. This is one of the postural things that we will see, particularly in women. Um, the angle from your hip down to your knee has a name. It's called your Q angle, and women always have a larger Q angle than men. Their line will look much straighter. And because of that, women have a tendency to have weaker hips. And you can see how it's hard to stabilize when your leg is at an angle. Here, we're working on getting more into the midline. This is a link to some exercises. So if you put your first and last name in the chat box with your email, I'll be able to send you this PowerPoint so you'll have this link. Anyway, but you can find this on my website. All right, let's get into some nitty-gritty here. This is your hip joint looking from the front. Here's that ball and socket we talked about, the ball of the femur in the acetabular of the pelvis. This part of the pelvis is called your ilium. This long muscle is your psoas or hip flexor muscle, and it attaches to your spine, and it comes all the way in front of your hip and attaches down onto your femur. On the inside, there's the iliacus, and then these are all the hip adductors. These are the groin muscles in here. So you may have pain. If you have pain in the front of the hip, it could be an issue with this muscle. Actually, this picture doesn't show it, but the quad, that's the big muscle in front of your thigh, also crosses right here. So sometimes we have to look at both of those. You can see because this hip flexor attaches to your spine, the pain that you might be having here could be because of something going on up here. These are the muscles on the side of your hip. There are 3 glute muscles. This is the big one, the glute maximus. This is the medius. This is the one that actually helps you balance on one leg. We're going to see the third one in a different picture. This one, people have heard of the IT band tract, and that attaches to a muscle here called your tensor fascia latae. And so sometimes when people have pain, like right here, if I stick my finger in there and it's really sore, but they may feel the pain down here, it's because this is strained. People with just weakness, particularly women, it's because this muscle has become weak. And lately I've been seeing a lot more people where I think maybe the surgeons are recognizing it more. They're doing MRIs and seeing this torn. I don't know if we're seeing more of a prevalence, but I think we're just diagnosing it more. And so you get pretty significant weakness, and it causes your gait to be off and weakness. Let's see what do we got here. Oh, these are your hamstrings. So this is the back of your thigh, and that attaches to your pelvis. And then in the front is your quadricep that also attaches to your pelvis. So all these muscles could be a problem causing hip pain. It does not necessarily mean you have a hip joint issue. So I had a woman come to me, her name is Kathy, and by the time she came to me, she had already had her glute med repaired and a total hip replacement. And she had gone to therapy somewhere else for many months, but she was still having trouble. She came to me, and what I found was that her pelvic floor, her deep hip muscles, her deep core muscles were really weak, which wasn't found before. And that's what we worked on. I'm going to show you a picture. There's a picture of it right here. Okay. So this is your deep pelvic floor. All these little muscles here, they actually work as almost like a diaphragm where they hold in all your organs. And 9 times out of 10, I find a weakness here. They rotate your hip in and out, like if you were to bring your leg up to cross your legs to put on your shoe. but they stabilize your pelvis as you walk. These get activated by rolling over our foot when we roll over our toe during gait. So more often than not, there's a disconnect between the foot and here, which we call neuromuscular control. And that was Kathy's issue. And we worked hard on it and we got this stronger. And when she came to me, she walked, she was really set, like, I'm going to have pain the rest of my life. I'm not going to be able to do anything. You know what? She's playing pickleball now. She still has some weakness there, but she's functioning really well. So if you get to the right piece, you never know what you can achieve. Now we're looking at the back side of your pelvis and your spine. So here's your spine, your lumbar spine, made up of 5 vertebrae. Down at the bottom is your sacrum. Here's your pelvic bone called your ilium. And where that sacrum and ilium come together is called your sacroiliac joint or your SI joint. Sometimes, I remember I had a woman come to me many years ago. She had SI joint problem, and she had been seeing a chiropractor for many, many, many years. And he fixed it, get it back into place and get some mobility there. But the last few months, it just wasn't working anymore. So he said, you need to go to PT, see what's going on. When she came to me, I watched the way she walked and I assessed her strength and her mobility. And I said, I think you have a hip joint issue. I think you need a new hip. You need to go to the surgeon. And so she always thought she had back pain because that's where she felt it. But it was a hip problem. She did need a total hip. So sometimes we have to discern, like, is it coming from your hip or is it coming from your back? One of the issues is because the sciatic nerve, which comes out of your back, goes down the back of your hip, down through your butt, through these muscles here. So sometimes people have pain here or down the back of their leg. And we have to figure out, is it from your SI joint, from your lumbar spine? Is it something going on in just the muscles here being tight? I think that's my anatomy lesson. So let's summarize a little bit here. How do we discern what's going on? So an arthritic condition is in the joint itself. That's where the ball and socket joint has become narrower and it's rubbing. And how we usually, based on what you tell us and our exam, we can tell if it's coming from the joint. More often than not, people have groin pain. They may have pain, constant pain. The telltale sign is when I assess if they can rotate their hip, like I'll have them lay on their back and I'll turn their hip in and out. If there's loss of motion there, or if I can't lift their hip up, they're laying on their stomach and lift their hip up, they've lost a significant amount of range there. Then I make sure they have an x-ray. When they walk, there's a certain gait pattern that I see. And there's weakness, but weakness could mean just a weak muscle or a strain, the muscle's strained. Quite often, the glute med is weak, but it's often because the deep pelvic floor muscles have stopped working or they're not kicking in. And so then they overuse the bigger glute muscles and they become stressed and strained. And then you get a problem there, a tendonitis or bursitis, because this deeper stuff is not working. And I talked a little bit about how we're working on to get that neuromuscular control to get it back. Ultimately, when this isn't working and you start overusing the bigger muscles around the hip, you could get a strain in the muscle belly, or the tendon is irritated. You get a tendonitis, or you get a bursitis. You might have heard the word greater trochanter bursitis. Let me go back. So right here, let me get a little, oh, this is better. Okay. So this bony area on the femur is called the greater trochanter. Almost all these pelvic floor muscles attach there. Your glute muscles attach there. Your IT band, your tensor fasciae latae attach there. So you can get so the muscle turns into tendon, which attaches to the bone. So if depending on which muscle that you're overusing, you can get a tendonitis anywhere, and then you are irritated here. So the doctor may diagnose you as greater trochanteric bursitis, but it's because something is weak around here. Okay? If it's in the front of the hip, then it could be a psoas tendonitis. So it can be anywhere. So based on what you tell us, when it hurts the most, and our exam, which I'm going to talk about in a little bit, we can determine where it's probably coming from. So that's the hip itself. And I talked about how it could be coming from somewhere else. Quite often, it's coming from your core weakness. So I call that a postural weakness. It could come from your posture, or the postural muscles, your core muscles. Those are weak. So then you overuse those hip muscles, then you get a hip problem. Sometimes it's a movement disorder. The way that you move around in the world is not optimal, and then you overstress and you have a hip problem. Or as people get older, as your joints get tighter, your tendons get tighter, you have more immobility, and so then you don't move the way optimally. So these don't have official medical diagnosis, but it's more of a movement diagnosis, a physical therapy diagnosis. And a lot of times this is the issue. You may not have anything significant, certainly nothing that'll show up on pictures, MRIs, or X-rays. So we are working on this the majority of the time is to get all this working together. So I talked about posture and core, and I think a lot of you have heard those words before. So your core is every muscle below your diaphragm, between your diaphragm and your pelvic floor, in the front and in the back. So sometimes as people, particularly, let's put it this way. People gain a lot of weight. So if you're pregnant or you gain a lot of weight and then you lose weight, this muscle will separate here. And sometimes it won't knit back together when you lose the weight. And then you develop what we call a diastasis here, or a split, and that creates core weakness. Everybody's posture changes over time. And particularly you go through puberty, things change, and then as you get older and you develop compensation, you sit a lot, everybody has different posture. And patients come into me and say, oh, I have bad posture. And I correct them and I say, you don't have bad posture. This is the way your spine is. You're doing the best. Your body is functioning the best it can with the alignment that it has. So it doesn't necessarily mean you're doing anything bad. However, there may be a way to improve on it. We work on strengthening the weak components, work on the mobility components, so you can be as optimal as possible. Sometimes you just can't, as people get older, if they have osteoporosis and their spine looks like this, we may not be able to change that, but we can strengthen up things around it. We can keep things mobile as need be. Just a little graphic of, remember I said everything's connected. You get one little rock out of place, everything comes tumbling down. All right, here's a little tip. I am seeing more and more people that, particularly as we get older, and I found this in myself actually. A few years ago, I was cooking for Thanksgiving, and my low back started hurting me, which is unusual. I'm pretty lucky. I don't have back pain on a typical basis. And I realized that I was bending backwards here, probably to see, it's just the way I was compensating. And if you can kind of visualize this, then your muscles here get shorter or being overused, and they're going to get fatigued. You might have a problem here, you might have a problem here. So pay attention to where your chest is in space. A lot of people are like, oh, I don't want a humpback. Well, the humpback is here, your spine. Throwing your shoulders back is taking that scapula back here. That's not going to change it. I actually am teaching people how to lower your shoulders down so they're not bending backwards here. So keep an eye on if you're getting back pain or down here or in the middle, it could be where your chest is. Oh, yeah, here's our dancing skeletons again. All right, I think we're done with anatomy. Here are some more tips that you can get. It's an ebook that's available on my website. Or if you want, put your name, first and last name and your email in the chat box, and I'll send it to you. All right, everybody, nobody likes to talk about aging, but it's better than the alternative. We all age. It's all about learning how to live in the body we have and how to make the best of it, how to not let limitations like those para athletes define us. Aging doesn't define us. Things change. We lose muscle mass, we lose bone integrity. And because of that, our balance and flexibility become decrease. And that can make us more chance of falling and more issues and pain. It doesn't mean that we have to not do things necessarily. We may have to adjust how we do stuff. We may have to, some of the things that you may never run as fast as you used to. You may not be able to play tennis, but we find new goals and we new things that we can work on. And we learn how to live with the body that we currently have. My friend Carney is 73 years old and he's still doing triathlons. This, I love this. These three ladies, I just have to tell you this story. So it's 2015. I'm running the Tampa Half Marathon. This is the day before the race, and I'm standing in line at Starbucks, and these three women are standing behind me. My memory is that Starbucks line we must have been in line for 2 hours because we talked a lot. But this was the day before the race. So I'm like, why do you have medals? And they said, well, we just walked the 5K. And tomorrow we're going to walk the 10K and the half marathon. This woman with the happy birthday crown turned 80. If my memory is right, she's 75 and she's 70. They walked a half marathon, a 10K, and a 5K in 2 days. So that's wait a minute, 32, I don't know, like 35 miles. It's a lot. But they didn't let their age stop them. And you know what else they did? And we kept in touch. They walked across the country. So they started there was 5 or 6 women at various times. They started in Jacksonville, Florida, and they walked all the way to the center of Texas over a period of either 2 or 4 months. And they had a van. One person was driving. I think, a few of them were walking, so they didn't all walk the whole way. They took turns, but they essentially walked across. And then they took a break and they came back and they walked from mid-Texas to San Diego. So these ladies knew how to embrace life. They didn't let their age define them, and they kept active. Now, I'm not telling anybody you need to walk across the country because I don't want to do that, but I want you to embrace where you're at and embrace the new things that you can do and what you can still do. So it's important for us to figure out what is going on with you so we give you the right exercises. And the biggest mistake you can make is you can ignore it. Diane came to me, how old was she? She was in her 60s. And she didn't have pain, but she came to me. She's like, yeah, my hips are getting tighter and tighter. And I assessed her. I said, this is not just soft tissue. This is your joint. You need to see the surgeon now. Both her hips needed to be done. She had one done a couple of years ago, and I just got a phone call from her that she's getting the other one done. She waited so long that she lost so much mobility in her in her hips from the soft tissue tightness. We didn't get it fully back. Now, I haven't seen her in 2 years, so I'll see if it's gotten better because she was really good at doing her exercises and understood. but you can't wait too long. When it starts really tightening up and tightening up, even if you're not having pain, you want to get that hip replaced. When that hip joint goes, there isn't anything we can do in PT. You need to get it replaced. I had a woman last year, she kept putting it off and putting it off because she wanted to wait till she was on Medicare. And now she has a terrible hiatal hernia because the way she had to walk was moving all in this area. So she was walking like this. Does that make sense? And so she was creating that hiatal hernia. I haven't seen her. She was supposed to have surgery on something, one of the parts. So please don't wait. If it's bothering you, please go in and take care of it. So how do we know physical therapy can work? Well, if it's reproducible, what does that mean? Well, my hip is okay until I stand up after sitting a long time. And when I lay on my side, it hurts. Otherwise, it doesn't hurt. That's reproducible. If it hurts all the time, if it's achy all night long, I don't quite know when it hurts, that, something else we might be going on. And so we need to get that checked out. A number of years ago, I woke up one morning and I had back pain. I could run. A few days later, it was getting worse and radiating, but I couldn't quite pinpoint what caused it, made it worse or better. Eventually, nothing made it better. Um, and so I had to go to the doctor, and it turns out I had shingles, but I had pain for a whole week before the rash showed up. So that's not necessarily treatable by physical therapy. My friend Danny would have hip pain after walking 20 minutes. He worked out, he loved biking, but he had the funkiest gait you ever saw. And I had to really retrain him how to work. His wife threatened to not let him go on vacation if he didn't come see me. We got his feet and his hips working together, changed his whole gait pattern, strengthened up his hips. He was able to go hiking in Utah, I think 6 or 8 weeks after I started working with him. So again, don't wait too long. Come on in. So don't ignore it. That's your choice. When you go to the doctor, they may give you some anti-inflammatories, a shot, and then of course surgery is an option. You want to try to, there is a place for all of these things. Hopefully, we really would love you to come in to handle it and find out what's causing the problem. At some point, surgery may need to be done, but if we can get you stronger and get everything working together the way it's supposed to, you will have a better outcome. You might need a shot. We can do better in therapy because the pain is reduced. When you come in to see us at physical therapy, we do a complete evaluation. We look at everything, not just your hip. We want to hear your story of your medical history, every surgery that you might have had, because you never know if there's some scar tissue somewhere else that could be affecting this. Someone had an appendectomy, that's scar tissue that's sitting right in front of your hip. Any gynae surgery, abdominal, could be affecting the issue. Any time you may have fractured something, you were in a boot, maybe you hurt your knee when you were 20 and now you're 70, that all can play a role. And that's the beginning of learning about who you are and all the pieces of your puzzle. So we can put that together to figure out where we need to start with therapy and what's really going on. Once we evaluate you, we're going to work on making sure your mechanics, so the way you move, is as optimal as possible. We'll work on getting you the soft tissue to work better so there's enough play in them. Balance, getting everything working together, neuromuscular reeducation, strengthening. And we're going to assess whether you got the right shoes, and maybe you might need an insert, an orthotic. And we do all that with some hands-on therapy, education, exercises, and the neuromuscular reeducation. I think people don't quite realize when they come in here how, particularly as we get older and we age, we have to relearn how we do everything we do, how to sit, how to stand, how to walk, how to sleep. What's the best way to get your posture optimally? that is the biggest role that we play in physical therapy, is teaching you how to function. And I love doing that part. So actually, one of my favorite parts is really teaching you how to stand and walk again. One of the tools that we use is called an OOV. You probably will not see this at your average physical therapy clinic. The guy who created this in Australia, when he brought it to the States, the Pilates world grabbed onto it, and they're the ones who are using it. But it uses your body three-dimensionally, so you can't compensate. You can lay on your back. I have this between this gentleman and the wall. You can stand on it. You can lay on your stomach. You can do anything on it. You can be any age. Here, my son is doing a much more advanced technique. He's on one foot, and it gets your body to work as optimally as possible so you don't cheat. It gets those feet connected to your hips and core that I've talked about this whole time, the neuromuscular reeducation. And it activates your core and pelvic floor subconsciously, like it should be. The other device that this man created was called the balance sit. And you sit on this, and it activates your core subconsciously and your pelvic floor. And we cater the exercises to work around that. Here's my friend doing a little exercise on it. Shoes, we want to make sure you're in the right walking shoes. Orthotics. I am not against orthotics. I've been wearing orthotics myself for over 30 years. I have issues with my feet, and so I need them. I also had big toe surgery a couple years ago, and so I needed different kinds of orthotics. If I think you need them, I usually like to see people in therapy for 6 to 8 weeks because things are going to change, and then I send you to the podiatrist to get those orthotics made. All right, so back to my son, Drew. This was a few years ago. He made it through the Pleasant Prairie Triathlon. He got 8th place. He was happy with himself. My son has a really good attitude. He's not comparing himself to other people. He only looks at himself. And he knew where he was in time. He accepted that he was not going to win the race like he used to because hadn't been doing it for a while. So he was so happy with his race. And he embraced who he was at that time. Now, this year, he did the 2025 triathlon, and he's back. He got second in his age group. So he's doing really well again. And he's now married and 29. That's my daughter. She was his best person. So to show off a little bit, this was the Smoky Mountains. Well, thank you for listening and coming. I hope you learned something. I really enjoyed it. I'm happy to have a free consult phone call if you want to discuss your issues, or if you just want to set up an appointment, give us a call. If you are on Medicare, you do need a prescription. If you are not on Medicare and just have private insurance, you do not need a prescription. And please put your name in the chat box with your email, and I will send you links to a bunch of ebooks, blog posts. I've written lots and lots of information on my website that can be very helpful for you. And I've also just started a Substack that I don't know if anybody is on Substack or is aware of what that is. It's just an online way to get people to disseminate their newsletters. But so I've started a new Substack, which is really about learning how to live in a changing body. So it'll be different information than on my website. And if you're on my email list already, I think today you'll get the link to go there as well. So I'm really excited about that too. I'm writing more about how to live in your body and how to accept where you're at. And because so many people my age, I'm turning 63 next month, just totally didn't think aging was going to catch up with them. I've done everything right. I've exercised, I've eaten right, and we still get aches and pains. So working through that with them. So thank you for coming, and now I'm here to answer any questions.
Thank you so much, Denise. Anyone who does have questions, feel free to unmute yourself, or you can put your question in the chat, and then we can go that way. And Denise, I can follow up with the attendance emails as well, if you'd like.
Okay, cool.
Mhm. I see that Mike has already put his email in the
Yeah, I got
chat,
him.
but just in case.
Yeah, and I got that saved. So I'll send that out. Any questions? I'm trying to think if there's an answer the insurance question everybody asks about. Um, but the best thing you can do is just keep moving as best you can.
Do you have a favorite underrated, I guess, exercise or movement that would help your hips?
Walking sideways.
Oh,
So side step around the house because that works the side muscles. And that's what's usually weak, particularly in women. Men still get weakness there, but not like women because of the way our anatomy is.
mm,
And also standing on
interesting.
one foot, and even if you hold on a little bit, that'll help. You need to do a little something for balance every single day. Your balance needs to be reminded how to work every day. So it could be standing on one foot. You could stand with like your feet like this. Can you see?
Hmm.
Like one foot in
Tree
front of the
track?
other. Yeah.
Yeah. Hmm.
Okay. And it doesn't have to be like heel to toe. It could be a little bit apart. Okay. That'll help. It can make a big, big difference because we don't want you falling down. And I've fallen in the last couple of years. Women in their 50s and 60s, when they're falling, it's because uh, our brains still function as if we're, young women. And so we're moving too fast and we fall down. So our bodies don't respond the way we used to once we get older. All right. Well, enjoy the weather today. And the next time I'm doing this, it'll be summer. Maybe it'll actually probably be really hot in June. I think I'm doing it in June as my next seminar.
I believe so.
Yeah.
Yes, it is. It's going to be heel, low back pain, and sciatica.
All right. Well, thank you for coming and everybody take care. Have a good weekend. Bye.
Bye. Thank you so much.